For months, it's been hard to tell just how many nursing home residents died from the virus. Well, today, the state attorney general said that number is far greater than the official tally. But she also blames many nursing homes for failing to protect residents. Atia Collins joining us now live with more on this report and, Atia, the fallout.
Well, Adam, yes, like you're saying, according to that report, the issue here is the number of nursing home residents that died in hospitals versus those that died in nursing homes. Now, the Attorney General is saying that number is undercounted, and some senior advocacy groups and some people I talked to with parents in nursing homes, they aren't surprised. The question now is who or what is to blame. Tammy Norson, pictured here, hasn't seen her dad in weeks.
My dad calls me and he's upset because he can't see his family. And it's been going on for so long.
Many families like hers have been pressing the state for months for a true picture of the pandemic in nursing homes. Now, a new report from the Attorney General reveals COVID-19 nursing home deaths have been underreported by as much as 50%. According to the report, the Department of Health has reported about 6,400 resident deaths in nursing homes due to COVID-19 from March to August 3rd. But that doesn't include residents who got sick and later died at a hospital. Those numbers were counted separately. In addition to the deaths finding, the report also found insufficient PPE in nursing homes and insufficient COVID-19 testing. Critics are blasting the state health commissioner and the governor, but some advocates for seniors say the focus should be on improving care.
Well, the first thing I thought of is a very sobering kind of thought and very troubling, but not surprising. I will say, you know, all along it seemed like this nursing home count was underreported.
Cook hopes the investigation will uncover ways to better prepare nursing homes for virus outbreaks.
In long term, I think we have to look at, is the way we're providing long-term care the best way for older adults to receive that kind of care?
Now, following the report, at least one senator is calling on the resignation of the state health commissioner. Dr. Howard Zucker did send out a statement today saying in part the word undercount implies that the fatalities are wrong, which is not correct. He's saying the numbers were reported correctly. Reporting from downtown Rochester, Atia Collins, News 8.
All right, Atia, thank you. Health Commissioner Zucker also said today they continue to audit the number of nursing home residents who've died of COVID-19 in hospitals. But following the bombshell reports, he also released the latest numbers. Zucker says between March 1st of last year and January 19th of this year, 9,786 nursing home residents died of COVID-19. He says 3,829 of them died in hospitals, 5,957 in nursing homes. Zucker also said there were another 3,000 or so presumed nursing home COVID-19 deaths